Greetings. Welcome to my podcast, and thank you for tuning in. I'm Dr. Andrea Walker, a family nurse practitioner and owner of Dr. Andrea's Medical and Weight Loss Clinic, as well as Telehealth DNP, LLC. In today's episode, we will explore the latest trends in weight loss, focusing on additional medications that can enhance the effects of various GLP-1 medications for maximum benefits. Now, don't get me wrong, medications like semaglutide, Wegovy, Tirzepatide, and Zepbound are highly effective on their own and may be all that some people need. However, there are additional add-ons out there that can further support your weight loss journey for those that need it. It's important to remember that not everything is suitable for everyone, and not everyone will need or qualify for each option I'll discuss. I'll cover some of the popular add-ons, explain why they may be necessary, and identify who could benefit from them. Please remember to discuss all medical decisions with your healthcare provider. Do not start or stop taking any medications without their guidance. The information shared in this podcast is for educational purposes only and should not be taken as personalized medical advice. What is very important to remember as I briefly discuss each medication is that they have qualifications, risk, side effects, contraindications, and not everyone will qualify. So, while I might mention a medication that you think would be a great fit for you, please make sure to have an in-depth discussion with your healthcare provider prior to starting it, even if it is an over-the-counter medication, because again, everything won't be a great fit for everyone. Now, let's get started. First, we will discuss peptides. Sermorelin is an FDA-approved peptide that promotes muscle growth and repair. It is a synthetic version of a naturally occurring substance that causes release of human growth hormone from the pituitary gland, and it is injected subcutaneously. Sometimes someone who has already taken one of the GLP-1 injections for weight loss will ask about peptides in order to promote or maintain muscle growth. Generally, if someone even knows about peptides, they have either heard about it through a specialized weight clinic, off of social media, or from an online weight loss provider or program. I actually do offer peptides, but not to everyone. I typically only offer them to my patients who are already working out in the gym. While Sermorelin does promote muscle growth, it will work better if a patient is actually putting in the work in the gym to help prevent muscle loss. But this is a great addition to a person who is already taking a GLP-1 and is concerned about muscle loss and wants the additional weight loss. As stated, Sermorelin aids in weight loss by increasing your HGH, human growth hormone levels. This leads to many other benefits as well. By increasing HGH levels, Sermorelin can help boost metabolism, making it easier for the body to burn fat for energy. Higher HGH levels can also promote the breakdown of stubborn and stored fat, especially in areas like the abdomen. And it can improve lean muscle mass. While losing weight on Wegovy, Zepbound, Semaglutide, or Tirzepatide, it is common to lose both fat and muscle. Sermorelin may help preserve and even increase lean muscle mass, which is important because muscle burns more calories at rest than fat, contributing to a higher resting metabolic rate. And with more muscle mass, you might find it easier to engage in physical activities, further supporting weight loss efforts. Then there's appetite regulation. HGH can influence other hormones related to hunger and satiety, such as ghrelin and leptin. By helping to balance these hormones, Sermorelin may contribute to better appetite control, reducing overeating. Next is improved sleep quality. Adequate and quality sleep is crucial for weight loss, as poor sleep can disrupt hormones that regulate hunger and stress, such as cortisol, which can lead to weight gain. Sermorelint's potential to improve sleep quality can indirectly support weight loss by helping regulate these hormones. And lastly, enhanced energy levels. By potentially boosting energy levels, Sermorelin may make it easier to stay active and maintain a regular exercise routine, which is essential for effective weight loss. Now, let's discuss sarcotropin, which is another peptide a person can take in addition to taking one of the GLP-1s for additional weight loss and benefits. Sarcotropin is also designed to stimulate the body's natural production of growth hormone, which can have a range of benefits. Sarcotropin is a relatively new supplement designed to mimic the effects of human growth hormone in the body. It's formulated with a blend of amino acids, peptides, and other natural compounds aimed at stimulating the pituitary gland to produce HGH. This increase in HGH can lead to several potential benefits. Just like with Sermorelin, you'll get the improved sleep quality. HGH is naturally produced in greater quantities during deep sleep. By enhancing HGH production, sarcotropin may help regulate sleep cycles, particularly by increasing the time spent in deep sleep. Better sleep can lead to improved muscle recovery, more energy during the day, and a stronger immune system. Then, adding sarcotropin can also give your metabolism a boost. HGH has a role in regulating metabolism. By promoting the breakdown of fats and increasing lean muscle mass, sarcotropin, just like with Sermorelin, can aid in weight loss, especially when combined with a healthy diet and exercise. Some users of sarcotropin have even reported reduced cravings and better appetite control, which can also support weight management. And then there's the increased energy levels. HGH can improve function of the mitochondria, which is the energy producing components of cells. Enhanced mitochondrial activity can lead to higher energy levels, reducing fatigue and improved overall vitality. Of course, increased energy often translates to better physical performance, making it easier to engage in regular exercise. Sarcotropin has some other benefits that I will just mention, such as enhanced sex drive, improved cognitive memory, and improved healing from injury. But since those are not directly related to weight loss, I'll just mention those and continue on. Now, here are a few stats for sarcotropin. In a 90-day clinical trial, sarcotropin showed a 9% body fat reduction, 14% reduction of visceral fat, 5% increase in lean muscle, and 16% increase in IGF-1 levels. Sarcotropin is a liquid medication. With both of these peptides, sarcotropin and Sermorelin, lab work is needed prior to starting, and a person should give it at least a few months before deciding to stop the medications. I'm not saying you won't see benefits for several months, but to truly achieve optimal results, at least 3 months are recommended. You have to remember the ultimate goal is to build muscle. It won't happen overnight. Now, let's discuss some off label weight loss options. I'll start with metformin. If you have ever heard of this medication, the first thing that probably comes to mind is diabetes. Well, metformin is for type 2 diabetics, but just like with many diabetic medications, an off label use for metformin is weight loss. According to the Cleveland Clinic Journal of Medicine, evidence does support weight loss can be achieved with metformin in adults with obesity, with and without type 2 diabetes. So again, it is what is considered an off-label use of the medication, but weight loss providers do use this as an add-on to the GLP-1s for additional weight loss. Next is naltrexone and bupropion, which is generic for Contrave, but most providers will prescribe it as naltrexone and bupropion. Sometimes you will even see it prescribed as naltrexone only. But naltrexone and bupropion are two medications that, when combined, can help with weight loss. Naltrexone alone is an opiate receptor antagonist, which means it blocks the effects of opiates in the brain. It was originally used to treat alcohol and opiate dependence, but it also influences the brain's reward system and can reduce cravings and addictive behaviors. By modulating the reward pathways related to food intake, naltrexone can help reduce cravings for high calorie, unhealthy foods. This can lead to lower calorie intake, which is essential for weight loss. Additionally, naltrexone may affect how the brain responds to food, making eating less pleasurable, which can help curb overeating. Bupropion is a norepinephrine dopamine reuptake inhibitor that is commonly used as an antidepressant and for smoking cessation. Bupropion can help reduce appetite and increase energy levels, making it easier to stick to a reduced calorie diet and engage in physical activity. It may also help with emotional eating by improving mood and reducing feelings of depression or anxiety that can lead to overeating. When you combine the two, you get a synergistic effect. Naltrexone and bupropion work synergistically to target different pathways in the brain that regulate hunger, cravings, and energy balance. This dual approach can be more effective for weight loss than either drug alone. The combination helps to reduce the desire to eat and the frequency of eating, particularly by addressing cravings for unhealthy foods that are high in sugar and fat. Bupropion's stimulant's property can increase energy levels and physical activity, which further supports weight loss. By reducing the rewarding effects of food and addressing psychological aspects of eating, the combination can help individuals make healthier food choices and adhere to a weight loss program. So, this is why it could be used as an add on to one of the GLP-1s, especially for patients with cravings and who might need a little more help with weight loss. Now, let's discuss phentermine as a possible add on to one of the GLP-1 injections. So, with phentermine, you either love it or you don't. Phentermine is an appetite suppressant, it is also a stimulant, as well as a controlled substance. Just like I mentioned at the beginning, everything is not for everyone. I have some patients that are on both a GLP-1 medication and phentermine, and honestly, many of them receive a refill of phentermine occasionally, not every single month. They may get it to jumpstart their weight loss when it seems to have slowed down some. But like I have said in many of my episodes, to being on a weight loss journey, no matter what medication you're taking or program you are in, is having a weight loss provider and program that communicates with you. It cannot be a cookie cutter method. One patient may benefit from adding phentermine, whereas another might benefit from adding a peptide. And I'm very honest with my patients. I tell them up front, you can add on such and such, but you would be wasting your money because blah, blah, blah. So I do not recommend it. And I explain why I do not recommend it. Now, let's continue on and discuss lipotropics. I know many are familiar with lipo B12 shots. Well, there are so many lipotropics out there, but I want to define the overall term of lipotropics. Lipotropics are supplements, in this case, injections used for weight loss and fat loss. They are intended to provide additional benefits to a person's weight loss journey. The injections usually contain vitamin B12, but also may contain B6, vitamin B complex, BCAAs, which stands for branched chain amino acids, and then usually MIC, also known as methionine, inositol, and choline. I am a fan of lipotropics, and I want you to understand why I like these injections so much. So, here's why. Of course, the B vitamins, whether it is B12, B6, or the vitamin B complex, those are all going to give you energy. I think we all can use some extra energy. Then there's methionine, which is a branched chain amino acid. It aids in weight loss, glucose metabolism, and normal function of your immune system. Next, anisotol, which is a vitamin like substance. It improves insulin sensitivity, builds muscle, and aids in the loss of fat. Then there's choline. It is an essential nutrient similar to the B vitamins. It prevents the accumulation of fat in the liver and vascular system, helping the body to burn fat and making it easier to lose weight. Some lipotropics also contain chromium. Chromium is a trace mineral that helps the body use insulin to regulate blood sugar levels and break down fat. It can help with weight loss, increase muscle, decrease body fat, and my favorite, help with cravings. In my office, I offer chromium in one of my lipotropic shots, as well as capsules for those who do not like injections. People tend to love both. And then the last amino acid I will mention is L-carnitine. Some compounding pharmacies compound their semaglutide with L-carnitine, which is perfectly fine to do so. And some clinics include it in their lipotropic shots. L-carnitine is a naturally occurring amino acid derivative that's often taken for weight loss and can be considered a fat burner because it helps to reduce belly fat. It is not going to make your heart race or give you a headache. It is not a stimulant. Now, we will talk about hormone replacement therapy and the three sex hormones because this too can be an add-on to the GLP-1 medications to help with weight loss. The main female sex hormones are estrogen and progesterone. The male sex hormone is testosterone, as we all know. When any of these hormones are out of balance, they can cause weight gain or make it difficult to lose weight, even with diet and exercise, which is why I always suggest my patients to get their hormones checked if, quote, nothing seems to be working. Generally, an estrogen imbalance will be the culprit for women, and of course, testosterone will be the culprit for men. But progesterone interacts with estrogen, so it still needs to be addressed when it comes to replacement therapy. While I won't go too deep into hormone replacement therapy, just know that if you're someone who is truly struggling with weight loss, and I'm not talking about someone that's not losing weight as quickly as you would like, but the scale just won't move and it's been months since you have seen any progress at all, then you should definitely find a provider who offers hormone replacement therapy and set up a consultation. Now, I did not mention the thyroid hormones, such as TSH, T3, and free T4, etc. Usually, by the time a patient comes to me for weight loss, they have already had their thyroid levels checked and are on synthroid or levothyroxine or something for hypothyroidism. However, if for some reason you do not have a regular PCP and or have never had your thyroid levels checked, then I would suggest you get some labs for your thyroid as a starting point, even before getting a full hormone panel. Because it could just be that you have an underactive thyroid that's preventing you from losing weight successfully. Lastly, we will wrap up with vitamins and supplements to consider while taking any of the GLP-1s. First up is calcium with vitamin D. This is needed for bone health. Obesity adversely affects bone health, and losing too much weight too quickly can increase your risk for osteoporosis. Next is magnesium. Magnesium may be helpful for regulating blood sugar and insulin levels in people who are overweight, but many people take it to help relieve constipation. I strongly suggest you discuss talking to your healthcare provider first before starting a magnesium supplement. There are so many out there, and again, everything isn't for everyone. And then there's probiotics. Now, with this one, I feel like everyone should be taking a probiotic, but especially while being on a GLP-1. Probiotics serve several functions, but one of the most important jobs is that probiotics will help to improve your overall gut health. Preliminary research suggests that probiotics may increase GLP-1 levels, although more human research is needed. Increasing your GLP-1 level is the goal. And lastly, dietary fiber. I've said this before, but most of us do not eat enough fiber daily. Men should aim for 34 grams of fiber a day, and women should aim for 25 grams of fiber a day. If you are eating that amount, then great. If you are not, then you might want to think about adding a fiber supplement as needed. As always, I have enjoyed sharing my knowledge. And just remember to discuss all medical decisions with your healthcare provider before deciding to start or stop any of the medications mentioned. Guidance by your healthcare provider is always needed. Again, the information shared in this podcast is for educational purposes only and should not be taken as personalized medical advice. I hope you enjoyed today's podcast. I'm Dr. Andrea Walker, family nurse practitioner and owner of Dr. Andrea's Medical and Weight Loss Clinic, as well as Telehealth DNP LLC. I hope you have an amazing week, get some workouts in, and don't forget to meal prep. For more fitness and health related tips, check out my social media pages on Facebook or Instagram at Dr. Andrea's Medical and Weight Loss Clinic or Telehealth DNP. Until next week, take care.